All right, everyone. It's 2:59, and I do want to be respectful of everybody's time. On behalf of Aspen Dental Management, let me say thank you very much for joining us. Those of you who've been here a minute will have heard me say this already. My name is Joel Lowsky. I'm the Director of Academic and Industry Relations for Aspen Dental Management. I lead a team on the talent acquisition unit, which itself is a subset of human resources. I'm proud to be hosting this discussion with two of our practice owners. I have a theme for this, which is essentially how Aspen Dental practice owners have been getting by during the COVID crisis. But at the same time, I do want to make it clear that, I've borrowed the idea of an Ask Me Anything from Reddit online, and I really wanted to let you know there's some questions piling up. I look forward to posing all of them. And there's really nothing off limits as long as everything is polite and kind, and it looks like everything is so far. So I'm going to ask Dr. Keen and Dr. Oakes to unmute themselves and turn on their cameras. Great. And I'm going to turn off that sharing. So hopefully you're just seeing the three speakers. I'm going to put myself on mute most of the time. My job here is really just to help guide the conversation. So we're going to go right into it. Just one more reminder, you can use the Q&A box at the bottom of the screen to submit your questions if you'd like. And there's also a link to a Google form where you can submit questions. And I'll read the questions to the doctors and I'll read them out loud. And please don't hesitate to pose the questions. I really can't put that on enough. Let's start with just a quick introduction, and then Dr. Oakes, then we'll go ahead with some Q&A.
Sure. My name is Nate Oakes. I'm from Portland, Maine area. I have 3 offices up here in the southern Maine area, in Portland, Biddeford, and South Portland. I graduated from Tufts Dental School in 2013. I've been with the company since 2013. And currently I have two offices open. One of the ones that I'm working in right now is one I'm going to be purchasing probably in June or July timeframe.
All right, and I'm Ashley Keen. I have one office on the west coast of Florida. I graduated from LSU School of Dentistry in 2013 and started with Aspen in 2013. My one practice is currently closed.
Go Tigers!
Okay, so we're going to start with a question that someone submitted from our form. Simple question, on point, if I may say. What has Aspen Dental Management been able to do for you and your practices sort of in the last 3 weeks when the whole world turned upside down?
Ashley, go first. Take this one.
All right, so where do we even start? There's been a lot. Things are changing every day, so every day things are kind of adjusting, but what has happened is we've gotten guidance from industry leaders, from Aspen Dental Management, lawyers, HR personnel, you name it, to help us navigate this and decide what the best decisions are for ourselves, our teams, and our patients. So we've gotten guidance on whether to open or close, to furlough staff, how to work on the CARES Act and payment protection plan. We're on twice-a-week calls, updating us on all the information, helping us with PPE, you name it, we're working on it, and that's what Aspen Dental Management has helped us with. Nate, you have anything to add to that?
Nail on the head right there, perfect. Same exact thing I would have said.
So Nate, you said that you still have 2 practices open. Can you describe what's going on at those practices and what you're seeing?
We're just triaging a lot of emergency patients, like people who have had bombed out teeth that have not really gone to the dentist in a long time. I'm seeing a lot more abscesses and like extra oral swelling that might need to be seen by an oral surgeon if antibiotics aren't treating it. But for the most part, extractions, simple extractions, surgical extractions. Anyone that needs a root canal, I'm referring out to the endodontist. But restorative is at a 0 standstill right now. Anything that's not essential, we're just postponing their treatment until at least May 18th at this point in time.
Thank you both. So, Dr. Oakes, I think your question leads into one that somebody's put in the Q&A here. Do you require an endodontist to perform 1 or 2 visit root canals?
I mean, it's whatever they feel comfortable providing care, or how they feel comfortable providing care for that patient. if it's a slam dunk easy case and they don't have any issues, then finish in one appointment. If you need to have the patient come back, it's not the end of the world. Like, obviously it's what you feel comfortable doing with your license. If something feels uncomfortable, like, we're going to follow your recommendations for that patient's care.
Dr. Keen, anything you want to add on that?
No, I just, every patient, every case is different. There's no requirements or anything like that. You treat the patient the best way the patient needs to be treated.
Great, thank you. There's a question here that says, how have you managed your staff during this time?
You want to start, Nate?
Yeah, so I furloughed most of my staff in 3 locations. I'm down to just 1 office out of 3 offices. So I have an office manager, 2 dental assistants. One of my associates is working in that office right now, and I have a lab tech working there. And I'm working in the other office with just a dental assistant and an office manager, and we're just managing the patients that way. Eventually, we're trying to, through this whole SBA loan, we're trying to get our staff back as soon as possible, because there's other things that we need to do, like organize a drawer. Like, I'm totally okay with paying staff to do that, to get them back to work.
Yeah, and I can add, when this all first started happening, we saw demand drastically drop. And then when guidance came out to do emergency and essential care only, demand drastically changed. So we followed guidance to start by cutting back staff to like a skeleton crew, just myself, my office manager, and 1 dental assistant. It's important to know we never fired anybody. We never laid anybody off or furloughing them. And they're still able to maintain their benefits, which is important at this point in time. They get their medical benefits. And then once we made the decision to close, we furloughed the rest of the team, hoping to bring everybody back soon.
So do either of you have any associates currently working?
I have 1 associate working for me right now. Originally, it was my wife that was working in the office, and we had 2 out of my 3 offices open. And when we went down to 1, we actually made the financial decision to have our associate work for us, because he's going through the process of trying to build of purchasing a house, and we want to try and keep his cash stream the same so he get his bank loan.
I do not. My office is completely closed right now. We're referring all of our emergency patients to a sister office local.
So, and I sort of know the answer to this, so I'm going to ask it directly to Dr. Keen. There's a question here about, have you been able to provide dental care in any other ways, even though your practice is closed?
Yes. So just starting yesterday, with the help of Aspen Dental Management, we went live with teledentistry. So I've been able to screen patients through online platform, video chatting, and then determining what they need from there, whether I can give them an at-home solution, prescribe them some sort of medication, refer them to an oral surgeon or endodontist that's open and near them, or another Aspen office that is open and treating emergencies.
So what was involved in launching teledentistry?
It's been a learning curve. Every day we're learning something new. This has happened very quickly. So Aspen Dental Management helped us drastically. They set up the online platform for us. We had a full day of training. They mailed us laptops and all the equipment that we needed to make sure that we were equipped technology-wise. We brought back some of the regional managers to help screen some of the calls for the doctors, and they're there for constant support. And yesterday was pretty busy. It was our first day live, so we were learning a lot and trying to get a better system in place. Today, it's been a lot more relaxed, a lot more calm, and we're going to see that. We expect that demand is going to go up and down. Patients are going to come and go. Just have to adapt and adjust.
Great, thank you. And I appreciate the questions, folks. Keep them coming. I will do my best to get to them. The list is growing. There's a question here. Does insurance pay for teledentistry?
It's a very good question. I don't think anyone knows the true answer yet. Do we ever know what insurance pays for? Some insurance companies are saying that they are going to, if you charge out specific codes, so 2 codes have to be charged out together. That's going to be a learn and see too. We're not really sure, but we're hoping that most insurances will jump on and help.
Are the specialists such as oral surgeons and endodontists in your areas, are they still practicing?
Yeah, my oral surgeon was in my office yesterday, and he had a $19,000 day of like serious procedures of people who needed to have teeth out. The endodontist that I'm pretty good friends with, I'm still referring a ton of root canals to them, and they have their own specifications for what is deemed an emergency. So I let them make that determination. But yes, the specialists are still open around us.
Same around us as well.
And conversely too, I've had some offices, some oral surgeons are closed around me, and I'm getting their patients, and I'm managing their patients for them right now.
Yeah.
I'm jumping back to the top of the list. I don't want anybody to think that I'm ignoring their questions. So these are, we're sort of going in a very meandering flow here. What is your corporate treatment philosophy when it comes to endodontics and crowns? And is there such a thing as a corporate treatment philosophy? I added that part.
I'll take this one first. There isn't like there's no such thing as like a corporate dental school. Your license isn't a corporate license. Your license is individual. Dr. Keen, for instance, has different treatment modalities than what I have. But I'm also assuming that our patient base is not exactly the same. We have a patient marketplace that we have patients that come and see us that we're trying to capture, and they're all very similar, but probably most likely our treatment modalities are different. Does a tooth that needs a crown need a root canal? If it doesn't, then it needs a crown. If it needs a root canal, then I would do the root canal first and a crown after. That's typically the way that I was trained. Root canal needs it, crown. If it doesn't need a root canal, then just do the crown.
Yeah, I think there's a misconception that we're told in the corporate structure how to do dentistry, and that's just not how it goes. We do dentistry how we see fit. Whatever we decide as the clinicians is right for the patient, then that's how we treat the patient.
Great, great. My voice cracked. So here are some questions that are a little bit on point. In regards to PPE, have you been able to receive everything that you've needed, masks, gloves, gowns, etc.?
Go ahead, Dr. Oakes, that's you.
Yeah, we've been feeling the pinch. Like I was down to like my last 5 boxes of masks, and I'm like, son of a bitch, someone get someone on the phone so I can get some more PPE. And we've finally got like our first round of like N95 masks in the office. Thankfully, since we're running a skeleton crew, we're able to kind of just like disperse that PPE to our staff as needed. But we're finally getting the stuff that we really need into the office.
Yeah, from what I've seen, the offices are helping each other out. We have text chains, of offices nearby each other. If one office is short on something and another needs something else, they're sharing. It's all hands on deck. It's protect your people. That's what we're trying to do. Yeah.
When I closed two of the offices, I pulled all the PPE out of those offices to the 2 offices that I have open now.
Yeah.
And when you said you received sort of that emergency package, Dr. Oakes, was that an order that you placed, or did ADMI make those orders on your behalf?
No, ADMI did that for us. We were all asking for it, and from our supply chain, they kind of dispersed it like nationwide to where the offices that were open that needed it.
I know they've recently secured some more N95 masks and some we have the level 3 masks going out, face shields. They are working constantly around the clock trying to secure us more PPE and disperse it as it comes in.
Do you expect fee schedules to change as a result of COVID? And do you think PPE regulations will change?
Oh, that's a tough question. I don't think our fee schedules will change. My fee schedules have already been set for this year. I don't see that happening. And for the PPE, that's going to be, I feel like it's going to be really fluid. I think there is not a direct answer at this point in time. We know what we need to do. We had our certain level of precautions for, tuberculosis and any of the other like infectious diseases that we potentially come in contact with. With COVID-19, I think we're going to get more information from the CDC and the ADA for guidelines for what we need to do moving towards the future.
I don't think the CDC knows the answer to that, let's be honest.
Yeah, no. Not yet.
Sort of same general line. How are you alleviating patient fears of contracting COVID through treatment?
So I think the teledentistry is a big first step. We're screening every patient now before they get into an office. And if we can offer at-home solutions, we're trying to. When I'm screening patients, I'm also just upfront and honest with them. I'm asking them, hey, if you're not comfortable going into the office, do you want to try to figure something out that we can do at home? What is your level of comfort? The staff is constantly wiping, the patients see it, right? They constantly see the staff cleaning. They see us wearing our masks, washing our hands, things like that in the offices. And just talking to people. Communication is so important always, but even more so now. Just be honest with people. People appreciate honesty and communication. That's all you really can do.
I just stopped kissing my patients.
We at Aspen Dental Management do not condone patient kissing.
I'm kidding.
So I'm going to sort of combine two questions here that have been posed. How did you communicate to patients who had upcoming appointments that those appointments were postponed? And how are you communicating currently, if your office is closed, how are you marketing to folks about how they can contact you and if teledentistry is available and so on?
So for me in my market, when I close an office, at the ADMI side, they know the office is closed. And if you call my phone number for that office, it gets redirected to one of my open offices. So I have one office that's getting 3 times as many phone calls. So how we're managing that is just by having an extra person in the office who can help schedule and reschedule patients. If we really needed to have something in a pinch, our call center would help us with rescheduling some of these patients. And we're trying to get on top of, can we send these patients a text message to let them know that we're going to reschedule their appointment until after this COVID-19 pandemic kind of settles down. So we have a lot of different ways that we're dealing with it. On the marketing side of things, we're just reaching out in whatever way possible. Hey, we're still open for you. I've seen a lot more of our media online, our social media, saying like, you know, if you're looking for care, we're taking those emergent patients into the office.
Yeah, we before we closed the office, our team frantically was calling everybody that we could contact and get them rescheduled. And those that we couldn't contact, our call center has helped us with that drastically. They've been handling patients' calls, screening calls, those types of things. And just like Dr. Oakes said, all of our calls are being rerouted to an open office. Same thing now with the teledentistry. As they come in, they're getting rerouted and screened by the appropriate people.
All right, thank you. This question was posed early on. In fact, it was posed before we started, so I imagine they're very interested. It's also taking the discussion in a completely different direction. What does an Aspen practice cost?
You, Dr. Oakes.
Yeah, so right now, an unowned office that doesn't have an owner yet starts anywhere in the $350,000 to $375,000 range. If you buy an owned office, you're looking at whatever the market value is on the valuation for that office. So I purchased an office for $600,000, but that office is a mature office with 10 operatories and produces last year $3.04 million in patient care. So there's a range. It ranges.
And that's the purchase price. And then we also pay like management fee monthly to Aspen Dental Management to be our management company.
So I'm going to chime in a little bit. I honestly respect that you're probably most interested in hearing from the dentists, but a brand new practice, like Dr. Oakes mentioned, that goes for between $350,000 and $375,000. That's approximately half the cost of the practice. And the other cost is provided by Aspen Dental Management, and that includes, for a modern practice, an aligned scanner, and all of our new practices that will be open this year also have a CBCT scanner. So that includes absolute up to date and modern care hardware. Okay, so I've got a few more questions here. I'm doing my best to get to them as quickly as we can. Have you seen companies in your area start to offer verifications that the spaces have been cleaned or sanitized nightly and there's not any virus there?
I actually haven't. That is new to me.
No, I haven't either, actually.
If anybody in the chat has, sorry, if anybody attendees have seen that, feel free to post a comment in the Q&A and I'll read it to the group. Here's an interesting one. I'm going to read this one. So this is, somebody has said one of their concerns with DSO offices historically is the front desk personnel, office managers and schedulers who don't necessarily understand how to schedule endo specifically for a smooth day. So how does Aspen help an endodontist, or let's expand it to oral surgery as well, properly schedule a full day?
Take this one, Ashley.
Okay, so my office does have an endodontist that comes by twice a month and an oral surgeon that comes by once a month. And again, this goes back to communication, and that specific provider gives scheduling guidelines of what they prefer. And then we work with our teams to educate them and train them on what that means and how to do it. And if there's any questions, my team has no problem coming to me. I have a very open relationship with my team members. If they need something, they have a question, they can always come to me and ask, and we have that same relationship with our specialists. So it's very, again, that's a very provider specific thing. Productive to one provider is different than to a different provider. So it's a matter of you setting your guidelines and your requirements, and then us being able to talk to our teams about that. The team members want to make you happy. They want the place to run smoothly. They want patients to be happy. They want everybody to be successful. And so I think if we can give them the information that they need in order to do that, then that's the best way to accomplish a productive schedule.
And Dr. Keen does crown preps in 60 minutes, and I need 90 minutes, and I'm totally okay with that. Like that's just me. She can crush it. I'm just 90 minutes. Leave me alone.
Depends on the patient.
I'm happy to pose the question to the doctors, and if they need a hand with the response, I'm happy to help. Do you expect to see a halt or delay in the opening of new Aspen Dental practices that were supposed to open this year, but due to the economic situation in COVID-19, do you see a delay in those?
I think Bob talked about this. I think we're going to try and keep moving forward with some of these locations opening up. And I'm not 100% certain. I know that we're going to try and open close to 80 offices this year, and I could only assume that we're not going to open 75 of them in 1 month, or like push it off to open them all at once. I think we're going to try and stagger those.
I think it's a fluid situation too that can change. We can say one thing now, and a month from now it might be different.
Thank you. I'll just chime in again. My main role is as a director on the talent acquisition team. We are still hiring for a lot of positions nationwide, and that's a reflection of the anticipated end of the world. And so when things return to normal a little bit, we are anticipating business as usual, not only in the existing practices, but in our goal of opening practices in communities where there is a great need for it. So what was it that pushed you to owning rather than staying in an MCD role? A managing clinical director role, excuse me.
So, you know, a lot of us, when we go to dental school, we always have this picture in our mind of what our career is going to look like and where we're going to hang our hat and where our name is going to be placed. And I don't think that changes just because you start working with a DSO or Aspen Dental. And having that ownership and that pride in your work, I think, is part of it. And then also, I mean, we run these practices as managing clinical directors as if they were our own already. So why not become an owner and financially be compensated for what you're already doing?
Is there a time, is there a specific or set time frame between when a doctor starts working at an Aspen Dental practice and when they can move towards ownership?
For me, it took me 4 years to become an owner. There are some owners that are with the company that they became an owner within 6 months. So it varies, and it doesn't have to necessarily do with like, do they have better hand skills? Do they understand the business more? It also has to deal a lot with the opportunity that's available to them. If you're willing to be an owner and there's an opportunity for you to go and thrive in that marketplace might not be in Florida or Texas or Virginia. It might be in like Iowa or Indiana or California that you'd have to move to get into ownership faster. For me, it took me 4 years because the owners that were currently in the offices that I own now were transitioning to Florida.
I think most people usually start thinking about it more seriously after about a year, right? So you've gotten your feet wet, you're getting more comfortable, you understand dentistry a little bit better and our model and our patient base. And I think that's when those wheels really start turning. But again, that's every person, it's their own.
I mean, I never envisioned being a small business owner. And like after this whole crisis that happened in this pandemic, like I think if I was going to go into ownership at this point in time, I'd be way more scared. But the other reason why I bought the offices that I purchased, I love the patients. I love going into work every single day and turning the lights on and doing dentistry. I was actually talking about this with some other doctors. I'm going crazy. I'm only working 3 days a week right now. I literally can't wait to get back to working 5 days a week again, just like doing regular, like doing my essential and non-essential dentistry.
Great. Here's a question about the recent CARES Act. How has the CARES Act and some of the admittedly confusing details in there affected you and your practices?
Dr. Oakes, you want to take that or?
You go for it.
Okay, all right.
You
So
start. You start.
all right, it's super confusing. It's constantly changing. The verbiage in there is confusing. Luckily, and something that has made me very appreciative to be working with such a wonderful company is that we've gotten a lot of guidance and direction on what it all means and what it means for our specific offices. They have ADMI or Aspen Dental Management has teams that are working literally office by office, figuring out how those things affect them. For us, for me personally, it's the CARES Act and the payment protection plan has basically just enabled us to get money back into our team's pockets, and we're able to bring them back onto the payroll. Even if I don't open the office back up, we can get them back onto payroll, get them doing some learning and development at home or calling and rescheduling patients, just helping our teams. It's been wonderful for our teams, and the guidance that we're getting has been invaluable because honestly, it's so confusing to me.
The CARES Act to me is just legal jargon that I can't sift through. Like I tried to read the first like 2 or 3 pages or just things that I thought were important, and I couldn't even keep my eyes open. So the good thing is that we had a whole team that was able to direct us in where we should be focusing our time and efforts. And for me, it's dealing with the patients and having an entire CARES team that I have at ADMI manage that for me so I can get the paperwork done.
Thank you. Sorry, I'm just looking here. The questions are rolling in. Are the doctors that are currently furloughed collecting unemployment or receiving some assistance from Aspen?
Yes.
Unemployment, yeah.
Unemployment, and again, just for the sake of clarity, a furlough in our case means that everybody has their medical coverage provided.
Mm-hmm.
I've heard that you pay your dentists differently and that they are not paid on personal production or collections. Can you elaborate on how the dentists are compensated?
Go for it, Ashley.
Okay, so every dentist is given a daily rate, and that's different depending on the office, the market, what have you. So you get your daily rate, and then at the end of the month, they take your gross center profit, and so you subtract everything that you've spent, all of your controllable expenses, and you're left with the dollar value. And depending on your patient satisfaction or patient loyalty, you get a range, either 17 to 19, 20% of that. What number you're left with, let's say it's $20,000, that's what you're due to be paid for that month. That doesn't mean you get an additional $20,000. What that means is they take that $20,000, subtract out what you've already been paid, and the difference you get as basically a profit sharing check. So every month is different, and you're not just making money off of the dentistry that you do, it's what your entire office is doing. So what your hygienist is doing, what the oral surgeon and the endodontist are producing, your exams, your x-rays, plus your actual productive procedures. It's whole office. So if there are 2 doctors in the office, it doesn't create that cutthroat mentality, because you want both of you to be productive. I don't want an associate sitting and just doing fillings all day, because they're not producing, and then that's not as much money for the entire office. Does that make sense? Is that clear?
Yep. Dr.
Okay.
Oakes, anything you want to add on that?
No, I mean, for me, in a 2-doctor model, it allows the associate to benefit, because I'm able to kind of free my schedule up to have other treatment move into their chair, so I can do bigger cases like extraction, denture cases that they might feel uncomfortable doing. So I'm able to kind of fit that into the month and bump the production.
Great, thank you. This seems to be a follow-up question from a comment that was made earlier. The question is, I've heard that you're using the business loans to help pay for things like rent and, oh no, wait, I'm sorry, I'm combining 2 questions. I've heard that Aspen Dental Management has been negotiating to help lower rents. Is that true, and what's your experience with that? Sorry.
Yeah, we're trying to reduce costs any way possible. Right now, I'm deferring my commercial loan for 90 days, and it's not going to extend the length of my loan. All it's going to do is take those 90 days that I owed and just spread it over the remainder of my commercial loan payments.
Yeah, so Aspen Dental Management is negotiating with our landlords to try to get our rents either decreased or deferred. They facilitated our business loans being deferred if we chose to accept that option, but they kind of coordinated that for us as well. Cutting costs as much as possible, marketing, all the things on the back end. It's all hands on deck to decrease overhead right now.
Thank you. That leads into a next question. Does Aspen help with marketing and advertisement when you become an owner?
Yes. Yep.
100%, yes.
You don't have to worry about it. It's taken care of.
Nope, I don't do it.
And no, it's so specific. I try and explain like in the simplest way to patients that ask this question, but we are so specific on our marketing that we track phone numbers. Our phone number on Facebook versus Instagram versus the phone number that's on television versus newspaper versus the yellow pages, which we still use because our patients are like 87 years old. We track that. We see where all those phone calls are coming from, and we say, hey, we're getting more calls from Facebook. We're gonna push more of our money towards that in that marketplace to that type of advertisement.
So here's an interesting question, and I'm going to preface it with a question of my own. I get to do a little bit of editorializing. So the question that I'm adding is, do either of you have outstanding job offers for dentists who are supposed to start either after graduation or during this period with COVID? And I'm adding that to the question that somebody posed, this one via our Google form. Do you have any updates for any new hires that are waiting for licensure or graduation due to COVID? There's a lot of uncertainties and timelines for graduating students who have job offers with Aspen. So I can add to that, but I'd love to hear from you guys.
I mean, right now, I've hired 2 doctors. And I have no idea if they're going to graduate. They don't even know. The schools haven't really given them any direction. So they have the job, but I don't know if they're going to have the license. So that's going to really change what the fall looks like for me. If they haven't graduated, I might have to hire someone in the interim to help in the practices that I have right now.
Yeah, if you have a job offer, hang in there. Aspen Dental is supporting you. You're going to have a job as long as you get a dental license.
Yeah.
Yeah. I was going to say something similar from my seat, but actually Dr. Keen said that perfectly, so I'm going to draw my editorial for that one. This sounds like a planted question, and I'm going to look into the eyes of my camera and tell you that it's not. This is a question that's coming from the Q&A. What is the biggest misconception about Aspen Dental?
The one that everyone asks me, and I don't know if it's the same for Ashley, who is telling you how to do your treatment plans?
Yeah.
I am. It's me.
Yeah.
So like if I go in front of the dental board, they're like, so Dr. Oakes, why did you do this? It's well, that was my treatment plan. It wasn't anyone else. It was my own. So like it's I can't put the blame on anyone else except myself if I made a shitty call with a treatment plan option.
Yeah, I think the one that I always get is, what if you're not doing enough crowns or you're not doing enough, bridges, implants? There is no such thing. Nobody comes to your office and says, hey, you did way too many fillings last month. What's going on? Yeah, those things are tracked, but that's for your own knowledge. So you can look within yourself and think if your treatment plans are really what you want your treatment plans to be. There's no requirements for production or procedures or anything like that.
Thank you. And I'll editorialize that the biggest misconception is that ADMI is filled with glasses-wearing, gray-haired dorks. Two good questions in a row. Do you have any say in hiring your own staff, or does Aspen pick them for you?
No, I hire my own people. I interview and hire my own teams. When I took over the office that I'm in, it had a totally different staff than I have now, but my staff has been consistent for multiple years now. It's just about getting the right people in there for you. So having Aspen Dental Management hire your people makes no sense because you're the one that has to work with them every day. Now, if you don't want to hire your own people and you want help, sure, they'll do that for you too. I like a little bit more control. I want to, have a say in who's working side by side every single day. But, pick your poison.
I mean, I could have Aspen hire everyone for me, but then it's kind of like a crapshoot. You show up, you don't know like if they're a good fit for your office.
This one I will add a little bit. Again, I'm on the talent acquisition team. When a practice owner says they're interested in adding to their staff, we take that very seriously, and we will go out and usually do the vast majority of sort of the job posting and the screening of candidates, and we'll present candidates to the practice owner, and we'll be involved as a conduit for the negotiations. This is one of my favorite points to say. We will recommend a guaranteed daily rate, like what Dr. Keen described before, but the final agreement for both the guaranteed daily rate and the profit sharing is between the practice owner and the new doctor, because that's the one who has the final say. So we will help and queue up candidates and screen candidates, but the final decision is made by the practice owners.
Yeah, I can add to that. My recruiter that I work closely with is phenomenal and he knows me as a person. So the pre-screening, he finds people that he thinks are going to mesh with me and my personality. So definitely exactly how you described.
There was a question before about how associates were paid. How are specialists such as endodontists and oral surgeons paid?
They get, it's not a daily rate. They get a percentage of their production. So that is, from my understanding, they get, I want to say, is it 50%? Can you confirm or deny that?
I don't know.
I don't know either. That's an excellent question. I will dig into that one, and I'll supply an answer for the group before the end of the call. With regards to specialty, once again, this is harking back to the question before about scheduling. How is scheduling for follow-up appointments for specialty handled? The person that posed the question is hinting at past difficulties with another DSO of being able to schedule those follow-ups and seeing those follow-ups in a timely manner.
I mean, you schedule as needed. If you need to see a patient back in your schedule, you have 100% control of your schedule. Like if you need to have someone come back in because you need to drain an abscess or whatever, like, hey, schedule him on this day when I'm here for 45 minutes. Like, just, that's how you manage that.
Okay, continuing in this vein, once once you're hired, does Aspen Dental send you for courses such as implants, endo, Invisalign, and so on?
Yes and no. There are, Aspen Dental offers continuing education programs in all of those things, and you can choose to be parts of them or not. It can be recommended or not. You can do your own continuing education. You kind of make those decisions for yourself, depending on what you're wanting to do.
Yeah, I mean, I usually want my associates right out of school to shadow with me and work with me for about a month time frame, or my wife, who's also an owner. And during that time, I really just want them to work on getting comfortable with patients, getting comfortable with staff, get comfortable with coming to the office, how to use a computer system, like just get used to being in their own skin outside of dental school. As we add more difficult procedures into their schedule, if they are feeling more confident, then yeah, that's the direction that we go. But I'm not expecting you at week 2, I'm not throwing you into an implant course. I'm going to start sprinkling some of that stuff in over time, because that's not what I did. 6 months in, restored my first implant. Probably 6 months in, did my first full mouth extraction case. Was doing some root canals here and there, but not a ton.
This is a plug. Yes, it's a plug for a project that I'm leading, but if you check out aspendentalce.com/welcome, that is the same, certainly in terms of online web-based continuing education, that is the same content that is provided internally as well. And Aspen Dental is providing that literally for the entire industry. So if you go to that page, aspendentalce.com/welcome, you can sign up for that and see the content that is made available. I have a text here from one of my Aspen Dental Management friends. Specialists get 55% of production minus overhead costs.
There you go.
So thank you for that response. You know who you are. This is a question from posted in the Q&A here. I've seen many offices with as many as 10 operatoriums with only one X-ray machine per area. How do you navigate that situation with such a high patient load?
My office has 7 operatories, and we have 1 X-ray unit. You just have to work smarter, not harder, and be organized. The assistants get used to it really quickly. They're open communication. They know who's using it when. We try to stagger exams so that we don't have a ton of full mouth series or bite wings all being needed to be done at the same time. You figure out your flow pretty quickly. I've never seen it as a problem.
Same. I have 2 X-ray units in my office. In 2 of my offices, one of my offices, we're going to be relocating. I'm going to add a second one for the hygienist specifically, so the hygienist can be in those 2 ops, and they can share the X-ray unit themselves.
I will also add that my endodontist has a Nomad, the portable X-ray unit,
yeah.
So that makes it easy when she's there. It doesn't tie up for our new patient exams or whatever.
I think this question ties in. How many new patients do you usually see a day during non-crazy end of the world times?
In my 3 offices, I'm averaging about 6.5 new patients every single day for the entire month. But what's scheduled in there is usually 8 to 10 every single day, and they usually all show up.
Yeah, every office is different. I think right now we were averaging 6 this year, but back in 2016, when there were less offices around, we were seeing 10, 12 new patients a day. And there are still offices that do that to this day. But right now we're at about 6.
And we also track too, we've just started doing this in the last, 12 months, existing patients. And we're seeing that. And then an existing patient is someone who maybe they came in 2010 or 2016, they haven't been in the office, and they're back into the new patient chair where we're going to do a full examination on them. That doesn't count technically as a new patient, and it counts as an existing patient. But in that new patient column, I have them scheduled on the hour from 7 o'clock in the morning until 6 p.m.
So how do you balance that new patient flow and still maintain a high quality experience for the patient, for non-new patients, but also for those new patients?
I think it comes down to your teams because you, as a doctor, you're only one person and you're only with people for limited moments in time. But if you have a team that feels like a family, whether they're sitting with a dental assistant or sitting with your office manager or sitting with you, they're feeling cared for and they're feeling understood and respected and listened to. And it doesn't necessarily have to come from you. The patient experience is only as good as your team experience. And so having the right team in place and having happy, smiling faces and people who get along is where that all starts.
When I grew up, I saw my dentist, I don't know, maybe for like 10 minutes every single appointment. The reason why I went to that dentist was because I love the staff. I love the hygienist. I love the DA. I love the front desk. Like, those are the people that I was like, oh, I'm going to the dentist's office. I love these people. I'm going to see the dentist. And I'd be like, what's up, Dr. Pete? And he's like, see you later. And that was it. But I still love the guy. So it's all about the experience the staff creates for that individual person. Some people don't want that. Some people want to sit down with their dentist for like an hour, and the office doesn't work out for them for that reason. But they know that, and they don't end up being a patient anyways. They go to another office.
So Dr. Oakes, how do you manage having multiple practices?
So I have partners. My wife is an owner in one office. I have a partner in my other office, and I work in my third office. How I manage like mentoring my new doctors, I'll put them with me for 4 weeks, and then I'll kind of send them out into their new office, and I just touch base with them once a week, or every 2 weeks to see what they need help with. I'm actually physically chair side with them, looking at cases, taking a look at impressions, what they're having issues with, what they need help with. It can be a little bit stressful, but I still have hair, so I'm doing okay.
On the mentorship role too, every doctor who starts with the company goes through a month of what we call training or mentorship with another Aspen doctor. So even if they don't have Dr. Oakes to reach out to, they have someone else who they formed a great relationship with that they can reach out to as well. You go to a week-long training at our facilities in Chicago, and you meet a lot of doctors there. So there's always lifelines. That's one of the big benefits to being with a company like this, is you always have somebody that you can reach out to, that you formed a bond with, whether it's your partner, your owner, your managing clinical director, or Dr. Judge in Chicago. I mean, you name it, you've got support. There's always somebody there for you.
Yeah, and Ashley makes a great point. Like, if I'm not talking to my wife about the business, I'm texting her. Like, I had an issue, or like I'm texting another doctor, like my buddy in Oklahoma. I'll text him like, dude, what do you do in this situation? Like, we're always bouncing ideas off of each other, because as stressful as our lives are, probably someone's already gone through like this stressful situation, and they've navigated this really tight course to get you from point A to point B.
Yeah.
This is a question about the emergency walk-ins. Are you open for emergency walk-ins, or is there sort of a triage or an evaluation and then you appoint them?
So for me, it's straight up walk in. They call the call center. The call center will help them get scheduled, or they can walk into my office directly. But it's different for Dr. Keen.
Right now, or are we talking like normally? Right now, my office, you can't walk into, you have to call. There's a number on the door, or you call the office number and you get rerouted. But normally, on a day-to-day when this COVID-19 crisis isn't happening, yeah, people can walk in all the time.
Great. The questions keep coming. Is there any new information on the new implant program Aspen Dental is starting? And will that include loading or only restoring?
I haven't gone through it yet. I think Dr. Keen has some of her docs that have gone through it.
Some of the team around me have gone through it. It's a multiple step process. So the initial training is more about restoring and socket preservation and preparing for the implant site not placing, but there is a placing implant component that I don't think anybody in this current system has done. A lot of us have done our own implant training elsewhere through different programs. I did the implant educators course a couple years ago. So there's other options there too. But I do believe that that's still moving forward. The implant continuum is still moving forward. The courses are available to our doctors online. They're supposed to be doing some of those live webinars currently as the offices are closing when they have more time. I believe there's a 50-hour didactic portion to it as well that they can be working on and getting CE for. So it's still moving forward. It might be a little bit restructured right currently at the moment, but it is in the works.
This is a question about dental assistants. Are your DAs expanded function? And if not, do you train them to do temp crowns or adjust dentures or do impressions?
I do not have any expanded function dental assistants in my location. I do know that there's some offices that have them. My DAs make temps for me. My DAs in the state of Maine are not allowed to take final impressions for crowns, for dentures, and they cannot make adjustments on dentures. They'll seek those patients for me and I'll go in and see them.
Yeah, it's state dependent. I have expanded function dental assistants, but expanded functions in different states means different things. So I know expanded in functions in some states means they're placing fillings, not where I am. But yeah, in the state of Florida, they have to be expanded functions in the state of Florida to be hired as one of our assistants. But then of course the training they get in their schools is different school by school too. So yeah, I mean, me as the provider is teaching them how I want them to do specific things.
Can oral surgeons buy a practice?
Nope.
No.
Okay. Did you, on the topic of buying practice, did you consider purchasing or starting a private practice, non-DSO supported, before you went to Aspen?
Nope.
I didn't know. Honestly, I was in school in Louisiana. I was coming back to Florida. I was just happy to have a job. Never did I expect it to be a long-term solution for me. I'm like, oh, great. I'll get some good experience. I'll learn some, chair side mannerisms and get my speed up and do some more dentistry. I did never foresaw myself being here forever, but I fell in love with the model. I fell in love with the patients, the support, the system, you name it. And here I am 7 years later.
I interviewed at private practices before I interviewed with Aspen Dental, and I was turned down by 3 offices because I didn't have 2 years experience and I didn't do a GPR or an AEGD or whatever. And one of those offices is completely closed now. They couldn't find an associate to come work for them. The other 2 are doing just fine. So I went with Aspen because they had an opportunity and I hit the ground running.
Thank you. If this was a radio show, I'd go to one of our mobile callers. I've received a few text updates, and I am a all for clarity person. One of my updates here is that specialists can be paid up to 55%, and some of them do have a daily guarantee. So that's good to know. I'm also told that specialists in certain circumstances can be partner owners. So there's that, and that comes from someone whose opinion I very much trust. You know who you are. So there's that. I hope that adds a little color. Just a reminder, it looks like we've got about 7 minutes left. I want to be mindful of everybody's time. So what are the responsibilities and workload for a managing clinical director, and how is that different from those of an associate?
I can take this one. So as an MCD, you're managing 3 chairs. You're managing a few more office duties, tasks like hiring, firing. An associate, I just want you to do your dentistry. That's it. Focus on your chair. Obviously, get up and try and do some examinations. Get comfortable taking impressions for dentures. Get comfortable with the flow. I just want you to be able to feel like you are able to get through the office every single day and not feel stressed out. An MCD, you'll probably have those stressful days. I don't think I get that stressed out anymore. I think after my 2nd month of being a managing clinical director, I felt really comfortable. because I was to the point. I knew what I had to do. I had my treatment plan modalities. I had my ways to manage difficult patients or disgruntled patients. And that's what I'm looking for in the MCDs, to be able to take on some of those duties and tasks for me, training new doctors. And then if they want to move into that partnership role, then you're going to be able to buy into my office.
Yeah, I think that the MCD or managing clinical director is typically a little bit more experienced, or maybe has more leadership skills, is more comfortable and confident, their speed and their abilities talking to patients, and you're seeing higher patient volume, and you're doing more of the managerial and the business side. Whereas the associate, you don't have to be involved in the business side unless you want to be, so you can learn it. And then you're typically only seeing production patients, so crowns, bridges, fillings, extractions, what have you. The exams we start sprinkling in as you become more comfortable, get you working multiple chairs, get your speed up, confidence up.
There's a question here. I'm not sure if you guys can answer it, and if not, I'll reassure the person who asked it that I can reach out and we can talk about it a little bit. The question is, do you have any info on Aspen's loan repayment programs?
I mean, the only information that I have is that if you're looking to get into some type of loan repayment program, you're looking to go to a rural office. So if you want to have a loan repayment program here in Portland, Maine, that's not going to happen because it's a very saturated market. And for me, I have a very easy time hiring doctors here. If I owned an office up in Fort Kent, which is 6 hours north here in Maine, right on the Canadian border, I'd probably have a difficult time getting a dentist to work up there, and I'd probably have to offer a loan repayment program for them to make it worthwhile to go all the way up there.
Yeah, I agree. It's for areas where they have a hard time retaining doctors.
Thank you. I can add a little bit of color to that. There is over $10 million currently invested in loan reimbursement company-wide, and it's something that we're very proud of. We've also partnered with SoFi, and they are a loan refinancing company, and we've arranged for special rates with them. So even if you don't, a new hire doesn't get complete loan reimbursement or partial loan reimbursement, we've negotiated with these folks to get loan refinancing rates that are really competitive. In fact, I've used those personally for my own academic loans, even though I'm not a clinician. It's available to any Aspen Dental or Aspen Dental Management employee. So with just a few minutes left, Dr. Keen, Dr. Oakes, is there anything that you feel we haven't covered yet? And I'm going to be a little greedy here, specifically with regards to how being a professional partner with Aspen Dental Management has supported you or helped you out through your career, and especially now as things have gotten unprecedentedly difficult?
Go for it.
All right, so 7 years I've been with the company, so a lot has changed, and you personally go through changes too. And it would be a lie for me to say that everything's always been hunky-dory, right? The grass always seems greener sometimes, and you get into these funks. It's dentistry, it's work, and sticking with a company who supports you in every which way has been the best decision I could have made for myself. I've always had somebody that I can turn to, and when I am struggling for whatever reason it is, there's somebody there for me. And if I were on my own in private practice by myself, I can't necessarily say I would have that. And specifically now, it has made me appreciate the company even more, because there's so many aspects of the world right now that we just have never been through before. We don't know how to navigate. We want to make sure we're making the right decisions for ourselves and for our teams and our patients. And the Aspen Dental Management has provided that for us 1,000-fold. So I'm thankful, I'm grateful, and I wouldn't change it.
All of that, and the only thing that I would add on top of that is just having this platform to speak to people, getting in front of students, getting in front of doctors, getting to meet people like Dr. Keen, being exposed to things that I would have felt uncomfortable doing on my own without the support of ADMI. Recently, Dr. Keen and myself have become board members of the American Academy of Clear Aligners. So we get to do a lot of stuff with different doctors across the nation and even globe. So I was exposed to that through Aspen Dental. I don't think I would have been exposed to that any other way.
Great, thank you. And since we have technically 1 minute left, I'm going to pose a question that just came in. So Aspen Dental doesn't do contracts. So does that mean that they can technically fire you without warning, or is there some sort of protocol if it is not working out between an owner and an associate?
It depends on the state, actually. Some states, it's like hire and fire on will. And in the state of Maine, I can terminate employment. I could go on Monday and be like, see you later, bye.
But I've got to chime in here. That would be a decision that you make. Is
Right.
Aspen Dental Management involved in that decision?
They can support me with whatever decision I want to make. Obviously, if it opens me up to legal issues, they're probably going to guide me in the direction to not open myself up to a lawsuit.
Yeah, you make your own decisions, but it's not going to be a surprise. We don't just walk in and fire somebody without them knowing. We have people are
Right.
documented conversations and documented progressive plans and moving forward what you should be working on. It's not a surprise. You're not going to just walk in one day and be completely blindsided.
Yeah, I mean, if you did something,
if that relationship is off.
if you did something egregious and you physically hurt someone and you knew you hurt someone, most likely you would be terminated on the spot.
Yeah.
Right. So on the interest of not ending on the topic of terminations,
Yes, sorry.
does anybody, do you have any sort of final words for our crowd?
Yeah, sorry, go first, sorry.
No, I just want everybody to stay safe and take care of yourselves and your families and make sure that you're comfortable with whatever you're doing out there in the world. And hopefully we'll get to meet some of you at some point in time.
Same, and if you have any other questions that weren't answered, you can email me at Dr. Oakes at aspendental.com. I'm certain Joel will be able to post that somewhere.
My email as well, Joel, if you'd like to share it, it's fine.
Sure. I've just posted again, again, aspendentalce.com/welcome. That's the free CE that we're providing. There's my email address on there. Feel free to email me and I could certainly put you in touch with Dr. Oakes and Dr. Keen.
Yeah.
Let me just say real quick, Dr. Oakes and Dr. Keen, we've only had 4 people drop since we started the meeting. And I think that's pretty awesome considering how many people are actually on here. And I think that's a testament to your honesty and your quite interesting folks, and I appreciate you answering the questions. To our guests, thank you very much for attending. I sincerely hope that this was valuable for you. Please don't hesitate to reach out. Everybody stay safe and take care of your patients.
Yeah, thank you.
Go do a virtual happy hour. Virtual happy hours.
That's right. It's Friday afternoon. Bye, everyone.
Bye.